Hey guys, it's Susan from reversingautoimmunity.com. I hope you're having a great day. I wanted to make this quick video for you today because we're talking a lot about root cause of your autoimmune conditions lately, and I want to give you one marker on your blood work that you can kind of take a look at if you've got some recent results at home with you. It's a marker that I use to sort of give me an indication of what's going on with this person. And the marker is one of your white blood cells. You have, I believe, 5 white blood cells measured on your complete blood count. It's a CBC. It's part of a normal blood draw that if you just get yearly physicals, they're often doing. And hopefully, if you're visiting a rheumatologist and seeing them regularly, hopefully they're doing this as well. But one of the ones that stand out most to me, and that almost everybody has elevated, is the monocytes. And monocytes are just one of the white blood cells. They're classified as like secondary invaders. They go in and they kind of try to attack the inflammation and clean up and do what they need to do to bring down whatever is causing the inflammation. And a lot of times when I see this, it gives me a red flag that this person has something going on in their gut. And it's never a surprise to me because so many people have this situation. So, check out your blood work and see if you've got elevated monocytes. If they're over 7, I believe it's percent. If you have over 7% monocytes on your blood work, you likely have some sort of gut bug that's causing inflammation, and that's causing sort of like an inflammatory cascade. Step after step, things just keep happening. That results in nutritional deficiencies, and then your liver doesn't work well, and then your kidney doesn't work well, and then you have pain and bloating and headaches and fatigue, and it's just a really nasty cascade. So what we do is we kind of backtrack that cascade and we look at where the source of inflammation is coming from, and one of them, like I said, is the monocytes. And once we see that there's an elevation, I also look at the other white blood cell counts in addition to that, and sort of make a decision as to what might. Oh, and I also look at what digestive symptoms you might be having. I personally had no digestive symptoms at all except for a little abdominal distension, which is virtually nothing for the amount of gut inflammation that I had on my blood work. So basically, when you see that, either you have a candida overgrowth, you might have SIBO, that's small intestinal bacterial overgrowth. You have some sort of a bacteria that's in your gut in an overabundant amount, and it should not be there. Your small intestine, unlike your large intestine, is actually a sterile environment, and you're not really supposed to have bugs there. And if you've been on a course of antibiotics in your lifetime, which everybody at this point has, if you have a really horrible diet, you eat McDonald's and other standard American diet foods, this can really contribute to an overabundance of bad bacteria, and they excrete toxins that cause inflammation themselves. Then they block nutritional absorption, nutrients being absorbed into your bloodstream from the food you're digesting. And like I said, that causes further problems, leading to organs and systems not really working appropriately. So we need to get to the root cause, and one of the great places to start is by looking at your white blood cell count, and particularly your monocytes, because that will tell you that there's some sort of long-term, not really horrible but not really good level of inflammation coming from your gut, and there's something that needs to be addressed. So if you do find something, feel free to send me an email or approach me if you want to sort of further investigate what the bugs might be and what they might be doing, and I'll help further refine a strategy for you moving forward to eradicate the bugs and rebalance your body system. So I hope that helps, and I hope you have a great day.